Today we're going to be talking about breast surgery codes specifically for 2023. There's some changes that we need to be aware of. Our objectives today will be to look at these 2023 surgery data items, the new 2023 surgery codes. We'll also review the 2022 breast surgery and reconstruction data items that were added last year, and we'll end with a few case scenarios. For cases diagnosed January 1st, 2023 and forward, we will no longer code the surgical procedure to the data item surgical procedure of primary site. We have a new data item to capture this procedure called Rx Hosp-Surg 2023. This new field will be available when your abstracting software is updated to V23. For cases diagnosed before 2023, of course, we'll leave this field blank. This new surgery data item has been added for all sites, and the good news is for breast, the new codes are very similar to the surgical codes we're accustomed to using. The code format has changed from a 2-digit numerical code to a 4-digit alphanumerical code. The new code uses the same 2 digits, but begins with the letter A and ends with a 0. The surgical code definitions have not changed for breast. So let's dive deeper and look at a side-by-side comparison of the old surgery codes from STOR 2022 Appendix A, shown in the purple box here, and the new ones from STOR 2023 Appendix A in orange. Notice the codes are the same with the addition of the A at the beginning and the 0 at the end. For example, a partial mastectomy was coded to 20 in the prior data field and is now coded to A200. Similarly, a simple mastectomy was previously coded to 40 and is now coded to A400. Notice the descriptions for each surgical code are the same in both boxes. They have not changed. As a reminder, these codes are hierarchical, so if your registry software allows for only one surgical procedure to be coded, be sure to code the most invasive procedure that is listed further down the list. For example, if a patient undergoes a lumpectomy, which is surgical code A220, and then a total mastectomy A400, code the total mastectomy since it's further down the list. Remember, we will continue to use the 2-digit codes in the purple box for cases diagnosed 2003 to 2022, the new codes in the orange box for cases diagnosed in 2023. In addition to the new surgery data field, we're instructed to continue collecting those 4 breast surgery and reconstruction data items that were added for cases diagnosed in 2022. These are located in the 2023 STOR manual starting on page 217. Let's do a brief review of these. Rx Hosp-Surg breast records the most definitive surgical procedure performed at the reporting facility. Rx Surg breast is a summary code that records the most definitive surgery performed at any facility. Rx Hosp Recon breast records immediate reconstruction performed at the reporting facility. As a reminder, this reconstruction must be performed during the same procedure and while under the same anesthesia as the resection. Reconstruction performed on a different day than the most definitive breast resection is not collected. Another important note regarding the reconstruction codes is only ipsilateral reconstruction is coded to these fields. Lastly, Rx Recon breast records immediate reconstruction performed at any facility. Please note that these last 2 data fields also are 4 alphanumeric digit codes that begin with the letter A, so be sure not to confuse these with the new surgical codes we're discussing today. Let's look at some examples. In this first case, the patient was diagnosed on 2/7/23 with grade 2 invasive ductal carcinoma of the right breast found on biopsy. The patient returned for a right partial mastectomy with sentinel lymph node biopsy on 2/22/23. For the Rx Hosp-Surg 2023, we will code A200 for the partial mastectomy. The patient did not undergo any other surgical procedures elsewhere, So the Rx Hosp-Surg 2023 will be the same, A200. Rx Hosp-Surg breast will be B200 for the partial mastectomy. Again, the patient did not undergo any other surgical procedures elsewhere, so the Rx Hosp-Surg breast will also be B200. Rx Hosp-Recon breast will be A000 since the op note did not mention any reconstruction performed during the procedure. The patient did not undergo any other surgical procedure with immediate reconstruction elsewhere, so the Rx Hosp-Recon will be the same. Okay, here's case 2. The patient was diagnosed on 3/10/23 with grade 1 invasive ductal carcinoma of the right breast. The patient returned for a right lumpectomy and sentinel lymph node biopsy on 4/5/23. The op note reports a re-excision of the margins was performed during the procedure in addition to oncoplastic repair. So how will we code this one? For the Rx Hosp-Surg 2023, we'll code A220 for the right lumpectomy. Be sure to read all the SEER notes when choosing the correct surgery code. In this case, there was a re-excision of the margins, and there's a SEER note that tells us to assign A220 when a patient has a lumpectomy with additional margin excision during the same procedure, which is the case here. According to the COC, re-excision of the margins intraoperatively during the same surgical procedure does not require additional resources. Therefore, we code it to A220. On the other hand, had this been a subsequent re-excision during a separate surgical event that required additional resources such as anesthesia, an operating room, surgical staff, that would qualify for the higher code A230. The patient did not undergo any other surgical procedures elsewhere, so the Rx Hosp-Surg 2023 will be the same, A220. The Rx Hosp-Surg breast will be B200 for the right lumpectomy. Again, patient did not undergo any other surgical procedures elsewhere, so Rx Hosp-Surg breast will be the same. Rx Hosp-Recon breast will be A300 in this case because the op report reported that oncoplastic repair was performed during the same procedure as the lumpectomy. And Rx Hosp-Recon breast will be the same. Okay, for our last case, the patient was diagnosed on 1/2/23 with grade 3 invasive lobular carcinoma of the left breast. The patient returned for a bilateral nipple-sparing mastectomy with immediate deep flap reconstruction and sentinel lymph node biopsy on 1/31/23 at the reporting facility. For the Rx Hosp-Surg 2023, we'll code A300 for the nipple-sparing mastectomy. There's a SEER note informing us that a subcutaneous mastectomy is also called a nipple-sparing mastectomy. The patient did not undergo any other surgical procedure, so the Rx Hosp 2023 will be the same. Rx Hosp-Surg breast will be B420 for the nipple-sparing mastectomy with removal of the uninvolved contralateral breast, since this was a bilateral procedure. Again, the patient did not undergo any other surgical procedures elsewhere, so the Rx Hosp-Surg breast will be the same, B420. Rx Hosp-Recon breast will be A610 since the op note reports the patient underwent immediate deep flap reconstruction during the same surgical procedure as the mastectomy. Deep flap reconstruction stands for deep inferior epigastric artery perforator flap. This procedure is performed using the patient's lower abdominal skin and tissue to reconstruct the breast. The patient did not undergo any other surgical procedures with immediate reconstruction elsewhere, so the Rx Hosp-Recon will be the same, A610. That's all I have for today. Thank you for joining me. I hope this presentation was helpful and have a wonderful weekend, everyone.